All right, so now we'll talk about abduction and adduction. Right? So abduction is going to be the teres crotulata, and then adduction is going to be the adductors. Right? So some of the muscles are going to do more than one action here. So you have the gluteus, and it's going to do some abduction, especially the gluteus medius. That's more right on the side. The gluteus max is more towards the back, but it is going to do some abduction. And then it's also going to do rotation. So gluteus max is going to do internal rotation. Whereas then you have some deeper muscles in the gluteal area, in the buttocks, that are going to be external rotators. We'll get to those. So now we'll talk about the adductors. So the biggest one is the adductor magnus. Okay, so that's going to go all the way down here. That's going to cover a lot of the femur. Okay, so the origin is going to be the ischial and the pubic rami and the ischial tuberosity. And then it's going to go again to that linea aspera. Okay, so a lot of these muscles are going to attach of this linea aspera. So that's why this is a raised portion on the bone. Because when it's like this deeper muscle, the vastus intermedius attaches to a lot of the surface of the femur. So there's not a lot of real estate left. So a lot of them are going to attach from thin little tendons that go along that whole line. So there's quite a few muscles that are going to attach from that linea aspera. And then that's the one that's going to go to this adductor tubercle. And then actually there's a little gap right there. And there's going to be, that's where different vessels are going to go through. Okay. So the anterior part is going to do adduction and then also medial rotation. And then the back part here is going to get into some of the hip extension. Because as it moves farther back, it kind of merges and becomes part of the hamstrings. So it's going to do some of the similar actions as the hamstring, whereas if you go more into this part, it's going to do more adduction. And then you have adductor longus, which doesn't go quite as far down onto the femur. It's going to be the pubic ramus, or the pubis near the symphysis, so it's going to be more medial. And then it's going to go again to that linea aspera, but not as much of it. So that's going to be adduction, and then flexion, and then also medial rotation. Then, as you get up higher, you have shorter ones. Here you have the adductor brevis. Okay? So again, that's going to come off of the pubis, and more specifically the body of the pubis and the upper ramus. And then again, it's going to go into that same linea aspera. And then again, that's going to do adduction and then medial rotation of the thigh. And then going up a little bit higher, here you have the pectineus. That's going to, again, there's a special line on the pubis called the pectineal line, and that's where the pectineus originates. And then it's going to go between the lesser trochanter to the linea aspera. So we're getting farther up here. Okay? So then that's going to do adduction, of course, and then also flexion and medial rotation.
Are these, like when someone says they have a problem with their groin, is that these muscles?
Yeah. Usually it's going to be the adductors, and then the gracilis, we're going to get to that. That's this one right here. Yeah, so that's going to be groin pull, because that's muscles that are pulling in here. So you have a groin pull, that's this area.
So those are the ones that like attach into this rear anterior pubis like that. Is that what defines it as a groin muscle, or is it all the adductors?
I don't know if there's if you specify as far as certain ones gets injured more than others, but this groin muscles is just a generality here. It's either going to have a groin pull or a hamstring pull. And then that leaves us with the gracilis, which is this one right here. Okay? So that's kind of more superficial than the other adductor. And again, that's going to go into this pes insurine area. So that's going to be a thinner, just more of a strap of a muscle, whereas you have the adductor magnus and the longest, so those are going to be bulkier muscles in your thigh, your medial thigh. So then that leaves us with the posterior group, which is going to be pretty much the hamstrings. So which is the biceps femoris, semitendinosus, and semimembranosus. Right? So that's going to, again, going to do extension at the hip and flexion at the knee. And then also the gluteus is going to also do more forceful extension of the thigh. And then especially if the, like when you're getting up from a seated position, when the hip is in a flexed position, that's going to, the gluteus is going to be more active to do that, as opposed to the hamstring. All right, so then we have the gluteus maximus. That's going to come from the posterior part of the ilium. That's going to be more on this, on the crest of it, because the other gluteal muscles are going to be deep underneath it. So it's going to be more from the actual top edge of the surface here. And then that's going to insert into the gluteal tuberosity on the back here, like we're saying right here. So, and then also it goes into that fascia, which is part of the iliotibial band. So it comes into that fascia, which becomes part of the iliotibial band and the fascia lata. So some of its insertion is onto bone, and some of it is into the common fascia around the thigh. And then, as far as action, it's going to be a major thigh extender. And then also it's going to do abduction and lateral rotation. And then you have the gluteus medius, which is going to be a little bit lower than the maximus, because maximus has come off of here, then the gluteus medius is going to be a little bit lower. And it tends to be a little bit more lateral. Okay? So that's going to do abduction. And so again, that's going to insert onto the greater trochanter of the femur. So it's inserting right up on here. Whereas the gluteus maximus is a little bit down lower here. So that's going to do abduction. And then also, same thing, medial. In this case, it's going to do a little bit more medial rotation. Gluteus maximus is more back here, so it's going to do lateral rotation, whereas gluteus medius can do medial rotation. And then one of the main actions of the gluteus medius is to stabilize the pelvis and hold it level when you're walking or running. Okay? So if I'm standing up like this, if you think of this gluteus medius muscle here, so when the thigh is not fixed, when the leg is not on the ground, it's going to do abduction like that, right? Okay. So what if I plant the thigh on or the leg on the ground? What action is it going to do to the torso? It's going to, yeah, it's going to laterally flex to the same side. Or you call this ipsilateral lateral flexion. So if the distal part is stabilized, it's going to flex the torso towards that side. Right? So when I'm going up like this gluteus medius is holding my pelvis up on this side. So there's conditions where you can have weakness of the gluteus medius, either from the muscle being weak or from interference with the innervation to it. And then you do a test called Trendelenburg's test, where you raise the leg up like this, and you're watching for the pelvis to drop up towards the other side. So here's the gluteus medius that holds up the pelvis. So it's, again, it's part of the mechanism that's laterally stabilizing the thigh, which is going to be the tensor fasciae lata, gluteus maximus, gluteus medius, has to do with stabilizing the pelvis.